Welcome to Microbiology. Some of the laboratory experiments included in this class may be hazardous if you handle materials improperly or carry out procedures incorrectly. Safety precautions are necessary when you work with any microorganism and with any chemicals, glass test tubes, and sharp instruments. Safety procedures and precautions. The microbiology laboratory, whether in a classroom or a working diagnostic laboratory, is a place where cultures of microorganisms are handled and examined. This type of activity must be carried out with good aseptic technique in a thoroughly clean, well-organized workspace. In aseptic technique, all materials that are used have been sterilized to kill any microorganisms contained in or on them, and extreme care is taken not to introduce new organisms from the environment. Even if the microorganism you are studying are not usually considered pathogenic or disease-producing, any culture of any organism should be handled as if it were a potential pathogen. With current medical practices and procedures, many patients with lowered immune defenses survive longer than they did before. As a result, the organism can cause disease in them under the appropriate circumstances. Each student should quickly learn and continuously practice aseptic laboratory technique. It is important to prevent contamination of your hands, hair, and clothing with culture material, and to protect your neighbors from such contamination. In addition, you must not contaminate your work with microorganisms from the environment. Once these techniques are learned in the laboratory, they apply to almost every phase of patient care, especially to the collection and handling of specimens that are critical if the laboratory is to make a diagnosis of an infectious disease. These specimens should be handled as carefully as cultures, so that they do not become sources of infection to others. An important problem in hospitals is the transmission of microorganisms between patients, especially by contaminated hands. Well-trained professionals caring for the sick should never be responsible for transmitting infection between patients. Appropriate attention to frequency and method of hand washing, including scrubbing for at least 30 seconds, is critical for preventing these hospital-acquired infections. In general, all safety procedures and precautions followed in the microbiology laboratory are designed to do two things. First, to restrict microorganisms present in specimens or cultures to the containers in which they are collected, grown, or studied. And two, to prevent environmental microorganisms that are normally present on hands, hair, clothing, laboratory benches, or in the air from entering specimens or cultures and interfering with results of studies. Hands and bench tops are kept clean with disinfectants. Laboratory coats are worn, long hair is tied back, and working areas are kept clear of all unnecessary items. Containers used for specimen collection or culture material are pre-sterilized and capped to prevent entry by unsterile air. Sterile tools are used for transferring specimens or cultures. Any student with a fresh, unhealed cut, scratch, or burn should notify the instructor before beginning or continuing laboratory work. If you have a personal health problem or are in doubt about participating in a laboratory session, check with the instructor before beginning. And remember, careful attention to principles of safety is required throughout any laboratory course in microbiology. Keep fingers, pencils, and other objects out of the mouth. Do not smoke, eat, or drink while in the laboratory. Discard all cultures and used glassware into a container labeled contaminated. This container will later be sterilized. Plastic or other disposable items should be discarded separately from glassware in containers to be sterilized. Never place contaminated pipettes on the benchtop. Never discard contaminated cultures, glassware, pipettes, tubes, or slides in the waste paper basket or garbage can. Never discard contaminated liquids or liquid cultures in the sink. If you should spill or drop a culture, or if any type of accident occurs, call the instructor over immediately. Place a paper towel over any spill and pour disinfectant over the towel. Let the disinfectant stand for 15 minutes, then clean the spill with fresh paper towels. Discard these paper towels in the proper receptacle and wash your hands carefully. Never remove specimens, cultures, or equipment from the laboratory unless specified by your instructor. Before leaving the laboratory, carefully wash and disinfect your hands, decontaminate your workstation, and gather your belongings for the next day. Thank you for watching.